Hello everyone, welcome to my channel, welcome to Ming Daily. This is week 5 of my internship in AstraZeneca, and today is hence day 21. Today I actually had 2 lab sessions, so very tiring. Came in the morning, had a very short and fiery pulse meeting, which is like a team meeting every week. Crazy. It was like 15 minutes, get the whole team's update. I love the efficiency, I love how they structured it out, and it was like talk about it and then move on. So I saw that one of the points was like, if it was more than 2 minutes, we would stop the discussion there and then we'll move on to the next topic, which I'm like, I should have done it in ICMS, just like chup, 15 minutes every week, you get high attendance. Well, most people try to attend because it's just 15 minutes updates that everyone knows. So yeah, definitely be thinking through how I plan out meetings in the future, like teamwork, group team meeting, just for updates meeting. After that, I had this sort of a one-to-one again with my manager. This time walking through the product development process. I think I would take time when I'm free to look through that whole product development process, as well as the documents and what are the information that they run through. So he talked me through a few risk assessment, but I think it would be a good idea to look through the documents myself, simply because it gives me a better picture of what everyone in the company is, well, in my department at least, is doing, instead of just them talking and us getting, because I feel like if I don't do the job itself, it's really hard to, let's say, understand. Like, you understand, but the work behind it, you don't really see it, and so you kind of think that, oh, it's not really a big deal, but actually it is. So yeah, I'll definitely, hopefully, this week my aim is to finish making all the capsules, and if there's free time I will read up on it. And then yeah, after that I went to the lab. After that we had a team lunch. It's quite nice. We went out to have a lunch together, but I think it might be because of my slightly introverted nature that when there were, it wasn't that many, it was like 8 of us, 9, but when there are like a group of people, I kind of not know when to chip in, and so I was quite quiet. And that whole day I feel like my head was really pounding. Not sure, I just feel very tired the whole time, possibly because my colleagues have been just talking non-stop all day, so that's why. And then after I came back, went to the lab again, and then finished up some of my ELAL and report writing, just writing down what I've done, which I think I did quite a good progress today. I have finished 1.5 of the report, so I've probably finished one of the reports, and the other one I finished half. But honestly, whatever's left is to just copy paste whatever I've written, or I'm going to ask the supervisor, because it's literally the same procedure, but then you add the materials, add different materials. So I'm likely to ask my supervisor what she thinks I should write. That's all, because it's just a repeat, like, it's just gonna take up space, to be honest. Yeah, and that's about it for today. So yeah, I'll see you tomorrow. Bye. Hello everyone. Well, so today I'll be vlogging for day 22 and 23, although it's technically day 24. Yes, and as you can see, I am back in London, this time with a visa appointment, so hopefully I'll get it done today. I also took today off, and yesterday I took half a day off. So back to what I did for the past 2 days. Yesterday was fairly straightforward. I spent 3 hours in lab, fully focused, just doing, just weighing out the powder blends that I made and making them into capsules. So it's a board slug tester. I've definitely showed you pictures of it before, but basically what you do is they have a die, sort of like a cylinder cone, but with a hole in the middle. So once I weigh out the amount of powder that I want, for example, 150 micrograms, or milligrams, and then I would tip it into the die, so it all falls into the tiny hole in the middle of the cylinder, and then I'll use sort of a weight force to compress it so that it sort of cakes up, and it won't sort of fall loose. And then I'll align the capsule bottom to it, and then use another tip to push it out into the capsule and then seal it. So pretty straightforward. That's how I manually encapsulate capsules. And I think we did almost 100 capsules yesterday, so I think that was quite good progress. I finished all the encapsulation parts for my project, and on Friday I'm just have to weigh out all of them, and that would be an interesting time because I have to spend quite a while weighing them out, just waiting for the balance to stabilize, etc. So yeah, so that means I can't really take a long weekend. I have to go back on Friday, unfortunately, but everything is required to keep my project like on track with time, even though I have to come out and take holidays for visa. So yeah, that was yesterday. And on Tuesday, so I kind of weighed out the remaining powder, did the blending, and then prepared some of the, so I did like around 30 plus 40 capsules on Tuesday, and then 100 yesterday. And yesterday Tuesday, on Tuesday I also had a bit of a free time in the afternoon, so I went to look at another intern's project, and he was basically working on benchtop TIM. You can look it up. It is basically a mechanical design of the human anatomy, so from your gut to your small intestines, etc. So you know how when we do like clinical trials, we try to well, not that we try, but we have to do them on dogs, on animals, before we do it on patients. Basically what we're trying to, basically all the in vivo tests, AstraZeneca is trying to eliminate the use of animals and use them all on benchtop TIMs. Not benchtop, just TIM models. TIM model is the full big one. I'll attach a photo as well. And benchtop TIM is ones that you can use on the benchtop, literally. So imagine as a robotic humans, but because you have to sort of design it such that it functions exactly like humans. So there are different compartments. So at the top, that's where you put the whatever medicine you want in, and then it will come down to the gut, so your stomach. There are two sections of it as well, and then inside there will be like pumps, so it will inflate and then deflate, so to stimulate the peristalsis motion. And in there they also put like fluids that have similar properties to your stomach fluid, so like the pH, the enzymes, and the vessel around it also has liquid, just to ensure that it is a similar temperature, like within the sort of stomach filling, and then you have it passed down through the ileum, the different parts. I think it's duodenum and the ileum and then jejunum. Hopefully I get it correct. and in there the different enzymes or bar, they get they're pumped into the system at different times, depending on the journey of the medicine. And at the same time, they can also stimulate fasted state or fat state. So actually today they're going to test out on a medicine, but I'm not in, so that was a shame. But yeah, they would feed the team with food, not solid food, but they would blend it sort of like a breakfast meal. You can also vary it to be like a low fat meal, high fat meal, what kind of enzymes are present in different parts, and they actually get all these data from patients. So they would let patients swallow a capsule. In that capsule you have a temperature probe, a pH probe, and some of them also have a camera, so you can kind of see what's going on in the body. And from there they collect the data at like different time points when it gets to the different parts of the body, what's the pH, what's the temperature, and then they try to emulate this similar parameters in your body, in the TIM, and they're using that to test out medicines. So they've been so successful that they've completely eliminated the need for dog colonies in AstraZeneca. So most of AstraZeneca's like animal studies are conducted by TIM. Of course, regulatory bodies are still finding it a challenge to accept this way of practice, but AstraZeneca has also tried to team up with other pharma companies to use this like technology, and say that since we are able to prove it, and they used like almost 200 of AstraZeneca's clinical studies comparing with TIM, and actually found that around 80% of the results are similar. So if we're able to use TIM as a control or a standard method for in vivo testing, that would be the ideal way. So yeah, and one thing to note is also the TIM was actually designed by an AstraZeneca member, so it was an AstraZeneca technology. And I was also talking to the staff who had designed it himself, and I was like, wow, this is so fascinating. Basically, yeah, it's like he said that to build the TIM it's around 1 million, but yeah, it is really high cost, but actually the savings from not having to conduct clinical trial studies, it's around 500,000 per project. So it's really the recoupment of the initial investment was very fast, and hence AstraZeneca would like to continue with it. And in terms of like sharing the technology, so the designer was like, yes, I designed it and I have the patent for it, but if I hold on to it and regulatory bodies will not accept this kind of testing methods, that's not really a point. So he was willing to give away the patent to share this technology with other pharma companies, which, you know, I feel like, yeah, I mean, it's logical with the way he said, but it's also the way that people think, you know, we want to put patients first, we want to follow science, and that's what we do instead of thinking of profit in the like front of your mind. So yeah, I feel like being in AstraZeneca opens my views that, you know, pharma company doesn't just work for money and things like that. They do put in a lot of effort to make sure that the patients benefit from it the most at the end of the day. So I think that's a good summary of what had happened for the past 2 days. Today's a day off, so I won't be vlogging anything further, and on Friday we'll see what we'll do. So I'll see you tomorrow. Thank you very much for watching. I'll see you tomorrow. Bye. Hello, this is day 25 and the last day of the week. Yeah, so happy that this week's over. I took a holiday yesterday, as you know. So today was mainly just weighing out all the capsules that I've made. which actually didn't take as long as I anticipated. So I think I spent around 2 hours weighing everything out, which I think was pretty alright, even though my supervisor was like, oh, that's so long. Not to say like I'm slow, but she didn't like doing repetitive things for like more than an hour. So yeah, but I was kind of cool of doing that. We had our meeting, not many people attended, but it was just a brief through of like what we've done, basically just informing the people that we've finished making our capsules. And then yeah, there were some problems with the Excel sheet, so I was figuring that out in the afternoon and then finishing my write-up on ELN. I also had a call with my manager, and this week he talked to me about quality and why we have to do the process measures that we do to ensure the quality in our products, and what are the bodies, like regulatory bodies, not just external but also AZ internal regulatory bodies that are looking through all these like documents, all these write-ups that we do. And yeah, it's also things like basically if there is someone who comes in to audit AZ and they want to check through like the materials used, the equipment used, the process used, was this process validated, and was this the same process that whoever's doing it, the person doing it, like is it followed accurately, or is there any deviation, and if the person is well trained, so everything needs to be documented, so that if someone comes in and check, they know exactly what have been done. So that's the part on quality. And I've also asked him if I can join in other meetings, so it actually scheduled me into a few other meetings on another project that he's on, so another medicine, which was kind of cool. I'm quite excited for it next week. So yeah, that's about the whole day, to be honest. Not many people was in the office, it was quite quiet. But yeah, that's the end of the week. Thank you so much for watching Ming Daily. I know it's getting shorter and shorter because things are getting a little bit more repetitive. But next week we'll start running our transmission Raman spectroscopy and hopefully analyzing some of the samples that we've made. So hopefully things will get more interesting then. Yep, thank you so much for watching. See you next week. Bye.